loading the anesthetic for people, like for the hygienist or the doctor. But we've had a lot lately. I don't know if it's something new with these plungers that the company's doing, but we've had a lot that are really hard for the doctor or the hygienist to express any anesthetic. So Dr. Hearn just wanted me to make sure everybody knows the proper technique for loading a syringe. Best way, especially when you're in the middle of a sedation, we're trying to be in a hurry, but you just need to make sure you're doing all the steps every time so that it's not getting bent in here. And he wants you to give it a good couple hits so that he can express some back to check for your veins and blood, whatever. He's making sure he's not gonna perf anything. And then when you're handing the hygienist or the doctor anesthetic, if you're giving it to them to give anesthetic, you want to make sure, like if your patient is here, you want to make sure you're keeping it like down where the patient's, you don't want to pass it like across and their eyes get all big and they're like, holy crap, look at that. Because Natalie said she's had a lot lately where we're like passing it up high over where the patient can see. If you can just keep it lower down, especially if they're watching a movie, they're really not going to pay attention, but just try to keep the syringe down where the patient's not going to see it, because even if you have the cap on or you're holding it, they know what this is and it's going to add that little bit of stress. So they kind of talked about that. The other thing with the anesthetic that people have mentioned is the wrong order of either lidocaine and carbocaine on lower blocks. I know Dr. Nielsen does his a little differently than Dr. Hearn does. So on any lower block, you're always going to start with lidocaine and then a carbocaine, and then anything on the upper is going to be septo. Dr. Hearn's the other way, where he'll start with septocaine for the lower block and then do carbo, but carbo's always second. So if you're loading the carbo first, you know you're doing it backwards. So lido or septo first and then the carbocaine. That's kind of it with